Before the ball clasp wire is adapted, the interdental area of the ball engagement usually needs to be prepared. Cut approximately 1 millimeter of interdental papilla from the interproximal space and simulate the margins of the two adjacent teeth. This is the non-connective tissue at cervical crown level. Place the preformed 0.028-inch wire ball head in the prepared interproximal space approximately 1.5 millimeters below the widest point of the two adjacent teeth. Mark the wire with a number 2 pencil at the occlusal embrasure. Place the 134 pliers on the ball head side of the mark, near the tip of the pliers. Incorporate a 100-degree bend around the conical portion of the pliers. Position the wire on the model. Note an approximate 1 millimeter relief is present at inside area of 100-degree bend to model. This gives the ball head a better angle to the undercut without wire interference. Caution must be taken not to have this bend protrude too far buccally, especially against the lower dentition, where occlusal interferences could exist. Hold ball clasp wire in place by pressing with thumb or finger against model. Mark the wire where it last contacts both teeth at the same reference. At this point, wire will be adapted to fit tightly between teeth as the wire crosses occlusal surface. With the 134 pliers, bend the wire at mark along occlusal and interproximal contacts. Position the wire on the model. Hold the ball clasp wire in place by pressing with thumb or fingers against model. Check previous bend to make sure wire lays flush to anatomy across occlusal surface. Mark the wire at lingual occlusal contact, which here is the last spot wire contacts teeth. At mark, bend wire towards tissue using the tip of the 134 pliers. Hold the ball clasp wire in place by pressing with thumb or fingers against model. Here the wire is too long and hitting against middle of palate, which is not allowing it to fit flush across the occlusal surface. Cut wire approximately 12 to 15 millimeters below gingival margin. Place the wire on model to evaluate fit. If previous bend was too big, then wire will push against model and lift wire away occlusally. Adjust if needed. Mark the wire at the interdental papilla reference. At mark, the wire is bent up to prevent tissue contact. The wire should be approximately 1/2 to 1 millimeter away from the palate. Create this bend using the tip of the 134 pliers. Place the wire on model to evaluate fit. Mark the wire after the outbend to contour wire 1 millimeter away from the tissue. Adapt wire using 3-prong or 134 pliers starting at mark. Place the wire on model to evaluate fit. Check previous bend to make sure wire lays flush to anatomy across occlusal surface. Mark the wire at palatal reference to keep wire 1 millimeter away from tissue. Adapt wire using 3-prong or 134 pliers starting at mark. Place the wire on model to evaluate fit. Mark the wire at palatal reference to keep wire 1 millimeter away from tissue. Adapt wire using 3-prong or 134 pliers starting at mark. Place the wire on model to evaluate fit. If previous bend was too big, then wire will push against model and lift wire away occlusally. Adjust if needed. An acrylic retention bend should be incorporated into the wire end. This will prevent the wire from pulling out of the appliance. This bend or series of bends must be parallel to the tissue approximately 1 millimeter away. The open wire end should face the anterior model segment to identify right or left side that it was adapted. Common wire retention bends include an L bend, a series of 3 zigzag bends, or a U-loop form. The L bend is created by holding the wire approximately 3 millimeters from the end with the tip of the 134 pliers. The tip of plier should point directly towards the tissue and wire bent 90 degrees around cone of pliers. Zigzag bends are created using the 3-prong plier. When creating the zigzags, start at the end of the wire and bend it in a mesial direction. Rotate the pliers and create a second distal bend above the first. Again, rotate the pliers and incorporate a mesial bend immediately above the last bend. The U-bend is created by holding the wire approximately 2 millimeters from the end with the tip of the 134 pliers. The tip of the plier should be pointed directly towards the tissue and wire bent 180 degrees around cone of plier. The open end of this wire should be pointing towards the anterior teeth. To incorporate the acrylic retaining bends to wire, the plier tips point towards the tissue plane and wire bent parallel to palatal surface.